Alex Bina here, and welcome to Biochemistry. In today's episode, we'll be talking about vitamins. So, what are vitamins? Vitamins are components in our food. Vitamins comes from a Latin name called vita or vita. Vita simply means life, and vitamins maintains our good health. Here are some of the characteristics of a vitamin. Those fat-soluble vitamins are stored in our liver, specifically in the adipose tissue. This is our liver, and these are the adipose tissue. They are found in our liver. Another characteristic of a vitamin is that those synthetic vitamins are identical to the natural vitamins, meaning they cater the same function. And those water-soluble vitamins cannot be stored in the human tissue, unlike those fat-soluble vitamins. Therefore, these water-soluble vitamins are excreted in our urine. And the last one is that this vitamin will be required in our body in smaller quantities. The general function of vitamin to our body is vitamin helps in the digestion and utilization of carbohydrates and mineral salts. Vitamins also stimulate digestion and nervous system. At the same time, these vitamins prevent and cure diseases and they build resistance against them. Literally, all food sources contain vitamins. Vitamins are classified into two, the fat-soluble vitamins and the water-soluble vitamins. The fat-soluble vitamins can be dissolved in fats, hence the name fat-soluble. These fat-soluble vitamins can be easily stored in our body for later use. They are stored within our fats that are found in our liver. The following are the fat-soluble vitamins. These are vitamins A, D, E, and K. On the other hand, the water-soluble vitamins can be dissolved in water, hence it's called water-soluble vitamins. Remember that the human body is made up of 70% water. Therefore, these water-soluble vitamins can move easily in our body. However, unlike the fat-soluble vitamins that they can be absorbed in the body tissue, these water-soluble vitamins can be flushed out in our kidneys. The different water-soluble vitamins are vitamin C and vitamin B complex. The vitamin B complex are the following: vitamins B1, 2, 3, 5, 6, 7, 9, and vitamin B12. These are the differences between a fat-soluble vitamins from a water-soluble vitamins. Fat-soluble vitamins dissolve in fat, while water-soluble vitamins dissolve in water. Fat-soluble vitamins require bile or bile acid to be dissolved and then absorbed, while water-soluble vitamins do not need that. They are easily absorbed in our body system, and they do not store in large quantities. Fat-soluble vitamins, on the other hand, can be stored in the body, specifically in the liver, within the adipose tissue. And at the same time, the water-soluble vitamins can be excreted via our urine. Then, fat-soluble vitamins cannot be taken in large quantities because they pose toxicity. So, toxicity is possible for fat-soluble vitamins, while water-soluble vitamins generally are non-toxic. However, in the following slides, we will also be mentioning the different toxicity level of these water-soluble vitamins. But generally, these water-soluble vitamins are not as toxic as fat-soluble vitamins. The first fat-soluble vitamin that we are going to talk about will be vitamin A. Vitamin A is also known as retinol. There are two types of vitamin A's. We have vitamin A and the other one is provitamin A. Vitamin A can be found mostly in meat, poultry, fish, and dairy products, while provitamin A can be found in mostly fruits and vegetables. Here are the different vegetables and fruits that has vitamin A. We have carrots, kale, spinach, cantaloupes, apricots, mangoes, broccoli, pumpkin, asparagus, and peaches. So we can also get vitamin A from eggs, dairy products, fish, and papaya. Retinol or vitamin A are solubilized into micelles. They can be solubilized in our intestinal lumen. Here is the diagram and the cross-section of our intestinal lumen. Retinol or vitamin A helps in the proper function of our vision, supporting the cell growth, immune function, and fetal development. The deficiency of vitamin A is known as VAD or vitamin A deficiency. Another name for the deficiency of vitamin A is called hypovitaminosis A. This is very common in children and women in poorer countries. And the lack of vitamin A in the blood and tissue has an early symptom called nyctalopia. This is a night blindness ailment. These are two contrasting photos between a person with a normal vision and a person that is suffering from night blindness. The image on the left is how a normal person views the place at night, while the image at the right is how a person with a night blindness vision looks at the environment at night.
Overdose of retinol or vitamin A is known as retinol toxicity. This is also called hypervitaminosis A. This can cause nausea and vomiting. Here are some additional symptoms of hypervitaminosis A: blurry vision, vomiting, vertigo, nausea, and for chronic, those who are taking too much vitamin A for about months or years can have hair loss, dry or peeling skin, hepatosplenomegaly, and arthralgias. So this time we'll be moving on to another fat-soluble vitamin, which is called vitamin D. And there are two types of vitamin D. Vitamin D3, which is cholecalciferol, and vitamin D2, which is ergocalciferol. The important function of vitamin D in our body is: one is to reduce cancer cell growth. This is by stimulating what we call apoptosis or cell death. Another important function of vitamin D is to help body absorption and retain calcium and phosphorus. These two elements are very critical for building human bones. Aside from the role of helping and keeping our bones strong and even our teeth, vitamin D also helps our muscle to contract, helps nerves carry messages between the brain and the body, and support our immune system. The sources for vitamin D is from a cow's milk, soy milk, orange juice, cereals, those that are fortified with vitamin D, and oatmeals. Exposure to sunlight can also be a good source for vitamin D because sunlight makes the skin manufacture its own vitamin D through the vitamin D receptor cells. This will convert cholesterol into vitamin D3. Here are some of the food that are very good source for vitamin D. Sun-soaked mushroom, eggs, oily fish, and of course, except for the sun, we also have fortified milk that are fortified with vitamin D. Vitamin D toxicity is called hypervitaminosis D. This is due to too much taking of vitamin D. However, this is a very rare condition. Hypervitaminosis D causes high levels of calcium in the blood. This is also known as hypercalcemia. Hypercalcemia can create kidney stones, weaken the bones of the person because it becomes brittle when there is too much calcium, and it can also interfere with the heart and brain functions. Here are some symptoms of too much of vitamin D: dizziness, appetite loss, thirst, headaches, fatigue, and nausea. Vitamin D deficiency is called hypovitaminosis D. This causes loss of bone density and rickets. Loss of bone density will contribute to osteoporosis and fractures of our bone. Rickets, on the other hand, usually occurs in children. Rickets can cause the bone to become soft and they will bend. This is how rickets looks like. These are other symptoms of vitamin D deficiency. One is mood change, bone loss, muscle cramps, fatigue, and bone and joint pain. Another fat-soluble vitamin is vitamin E. Vitamin E has two forms. Tocopherol, this is the most common form of vitamin E, and tocotrienol. Tocotrienol lowers cholesterol levels, and at the same time, it reduces the risk of cardiovascular diseases. So it is good to take vitamin E to lower the risk of cardiovascular diseases. The sources for vitamin E are vegetable oils, nuts, seeds, green leafy vegetables, fruit juices, and margarine. So here are the natural sources of vitamin E. We have pomegranate seed, sunflower, avocado, mango, spinach and broccoli, olives and olive oil, kiwi, and nuts. Vitamin E has a very vital function in our body, that is for the proper function of the brain and also to help our skin glow, for a good blood health, skin health, vision. Vitamin E is also known for its antioxidant property. It is also good in reproduction and eye health. Vitamin E protects our cells against damage from free radicals, keeps the nerve and red blood cells healthy, and prevents clots from forming in the blood, keeps the normal function of our brain and nervous system, and support our immune system. Deficiency of vitamin E is called hypovitaminosis E. This causes loss of body movement control, muscle weakness, vision problem, nerve and muscle damage that will result into loss of feeling in the arms and legs. Also, vitamin E deficiency can contribute to Alzheimer's disease, muscle weakness, kidney problems, again, poor vision, hair and skin problems, heart diseases, and fertility problems. Vitamin E toxicity is known to be hypervitaminosis E. This causes nausea, gastric distress, abdominal cramps, diarrhea, headache, and fatigue. The last of the fat-soluble vitamins is vitamin K. Vitamin K has two forms, vitamin K2, also known as minakinone, and vitamin K1, also known as thylokinone. Vitamin K1 sources are leafy green vegetables, vegetable oils, meat, dairy products, and eggs. Here are some of the green leafy vegetables that are very rich in vitamin K. We have kale, green snap beans, Brussels sprouts, kiwi, collard greens, turnips, spinach, cabbage, asparagus, and broccoli. Vitamin K1 or phylloquinone will treat prothrombin deficiency. This is a bleeding disorder. During a prothrombin deficiency, the body slows the blood clotting process. Vitamin K1 will also treat hypoprothrombinемia, which is a deficiency of blood clotting substance called prothrombin. This causes a prolonged bleeding of the person. This is a scenario of a bleeding disorder. Vitamin K2 comes from fermented foods, organ meat, and pastured dairy products. Vitamin K2 or minakinone activates a protein that helps the mineral to bind to our bones such as calcium. Generally, the function of vitamin K is 1. To help blood clotting in our body and to help form and keep our bone structure. Vitamin K toxicity is called hypervitaminosis K. This causes jaundice in newborns. This also causes hemolytic anemia. This is a condition where the red blood cells are destroyed faster than they can be made. It will also cause hyperbilirubinemia, which is too much of bilirubin in an infant's blood. Vitamin K deficiency, also known as hypovitaminosis K, will cause bruising and bleeding problems, such as this one. And it will also cause reduction of bone strength. This will increase the risk of getting osteoporosis. Osteoporosis is a condition where the bone density is reduced. This is the bone structure of a person with osteoporosis, and this is the bone structure of a healthy bone. We will now be moving on to the water-soluble vitamins, and the first water-soluble vitamin that we are going to talk about is vitamin C. Vitamin C is also known as ascorbic acid, and the sources for ascorbic acid are citrus fruit, peppers, strawberries, blackcurrants, broccoli, Brussels sprouts, and potatoes. Vitamin C or ascorbic acid helps in the growth, development, and repair of all body tissues. It also helps in the formation of collagen, absorption of iron, proper functioning of the immune system, wound healing, maintenance of cartilage, bones, and teeth. Ascorbic acid treats scurvy. The symptom of scurvy is tired and weak all the time, irritable and sad, severe joint or leg pain, swollen, bleeding gums, red or blue spots on the skin, skin that bruises easily. Again, the symptoms of scurvy is bleeding of the skin and mucus, gingivitis, loss of teeth such as this one, rough, dry skin, joint and body aches, muscle weakness, increased susceptibility to infection, fatigue, and depression. Vitamin C toxicity is called hypervitaminosis C, which is unlikely harmful. Hypervitaminosis C symptoms are nausea, vomiting, heartburn, abdominal cramps, headaches, and insomnia. While vitamin C deficiency, also known as hypovitaminosis C, which occur as part of the undernutrition that is very common to developed countries, are scurvy, which we already discussed earlier. Vitamin B1, also known as thiamine. Sources are peas, fresh fruits, nuts, whole grain breads, fortified breakfast cereals, and liver. We also have egg, cauliflower, flaxseed, potato, again, milk, lean meat, cereals, and those bread that are fortified with vitamin B1. Vitamin B1 or thiamine is essential for glucose metabolism. This will enable the body to use carbohydrates and to be converted into energy. Vitamin B1 or thiamine plays a role in the function of nerve, muscle, and our heart. It also treats beriberi, and this is a condition wherein first the dry beriberi will have symptoms of difficulty in walking, loss of sensation in the hands and feet, paralysis of the lower legs. Dry beriberi can lead also into nerve damage, and this can lead to muscle paralysis and decrease in muscle strength. Another condition of beriberi is wet beriberi, which can affect the cardiovascular system. These are the two conditions of beriberi. One is dry beriberi and the other one is wet beriberi. Vitamin B1 toxicity, also known as hypervitaminosis B1, can block the nerve transmission, and when this happens, it can cause paralysis, restlessness, convulsion, respiratory paralysis, and cardiac failure. This characteristic is a symptom of hypervitaminosis B1. B1 deficiency is also known as hypovitaminosis B1. This can again lead to the problem or a condition called beriberi. Again, wet beriberi can have fast heart rate and cardiac problem, shortness of breath, and swelling of the legs. While dry beriberi can have peripheral neuritis. This can cause severe leg pain and paralysis. Vitamin B2, also known as riboflavin. The sources are milk, eggs, fortified breakfast cereals, mushrooms, and plain yogurt. That includes nuts, liver, almond, eggs, cheese. We have broccoli and spinach. Vitamin B2 helps in converting carbohydrates into ATP or adenosine triphosphate. It also breaks down protein, fats, and carbohydrates. Vitamin B2 overdose, also known as hypervitaminosis B2, is very rare, but it can cause liver damage, photophobia, cardiomyopathies, vomiting, itching, numbness, burning or prickling sensation, hypotension, fatigue, production of bright and yellow urine, such as this one. The deficiency of vitamin B2, also known as hypovitaminosis B2, also known as araboplavinosis. The symptoms can include angular stomatitis, edema of the mouth and throat, skin disorder, loss of the hair, reproductive problems, sore throat, itchy and red eyes, degeneration of the liver and nervous system. Also include ichthyosis and hyperemia, which is an excess of the blood. This is chelosis, specifically known as angular cheilitis. Next is vitamin B3, also known as niacin, and the sources are beef liver, poultry, eggs, dairy products, fish, nuts, seeds, legumes, avocados, and whole grains. It can also include mushroom, broccoli, peanuts, chicken, bell peppers, and kidney beans. The role of vitamin B3 in our body is for metabolizing fats and proteins, converting those carbohydrates into glucose to be formed into energy later on, keeping the nervous system working properly. It also helps our bodies make fats and cholesterol, helps form and repair our genetic material, the DNA. Toxicity of vitamin B3, however, also known as hypervitaminosis B3, will have the following symptoms: liver problems, gout, ulcer of the digestive tract, loss of vision, high blood sugar, and irregular heartbeat. Lack of vitamin B3, also known as deficiency of vitamin B3 or hypovitaminosis B3. The symptoms can include fatigue, indigestion, nausea, vomiting, diarrhea, mouth sores, swollen, bright red tongue, poor circulation, and depressed mood. Deficiency of vitamin B3 can lead into pellagra, which is an Italian word which means rough skin. Vitamin B5, also known as pantothenic acid, sources are brewer's yeast, corn, cauliflower, kale, broccoli, tomatoes, avocado, legumes, lentils, egg yolks, beef, turkey, duck, chicken, milk, split peas, peanuts, soybeans, sweet potatoes, sunflower seeds, whole grain breads, cereals, lobster, and wheat germ. Again, here are the sources for vitamin B5. Pantothenic acid synthesizes coenzyme A, that is for the synthesis and oxidation of fatty acids and the oxidation of pyruvate. Also helps our bodies convert nutrients into energy and help our bodies make and break down fats. Vitamin B5 toxicity or hypervitaminosis B5 can cause no harm to humans. However, it can have a symptom that will be stomach upset and diarrhea. But if one is deficient with vitamin B5 or hypovitaminosis B5, can be the cause of neurodegeneration in Huntington's disease. This is characterized by a selective neurodegeneration that is caused by the expansion of a polyglutamine. This is the normal brain of a person, while this one is the brain of a person having the Huntington disease. And the symptoms of Huntington's disease is increased involuntary movements, weakness, difficulty in swallowing and chewing, speech issues, falling, fever, and severe depression. Vitamin B6, pyridoxine. The sources are pork, poultry, some fish, peanuts, soya beans, wheat germ, oats, and bananas. That includes potato, sunflower seeds, walnuts. Pyridoxine can prevent untreated heart disease, depression, anemia, and premenstrual syndromes. Vitamin B6 also helps our bodies convert nutrients into energy, helps form our red blood cells, helps form our genetic material such as DNA and RNA, supports brain development during pregnancy and infancy, keeps the healthy function of our brain and nervous system, and at the same time balances the level of homocysteine in the blood. This homocysteine can alter the coagulation properties of our blood. Vitamin B6 or pyridoxine toxicity, also known as hypervitaminosis B6, will cause paresthesias. This is a burning or prickling sensation, and also difficulty with ambulation, meaning walking without assistance. Vitamin B6 deficiency, also known as hypovitaminosis B6, can cause inflammation of the skin, a red, greasy, scaly rash. Hands and feet may feel numb and prickling, like there is a pin and needles that are prickling on it, and the tongues become sore and red. So again, sore and glossy tongue is an example or symptom of vitamin B6 deficiency. Cracked and sore lips and skin rashes can be also a symptom of the deficiency of vitamin B6. Vitamin B7 sources can be organ meats, egg, fish, meat, seeds, nuts, and certain vegetables. It is also produced in the good gut bacteria. They can normally synthesize vitamin B7, also known as biotin. Vitamin B7 rich foods can include tomato, onion, salmon, walnuts, sweet potato, lettuce, carrots, almonds, eggs, and cauliflower. Vitamin B7 or biotin helps use the enzymes carry nutrients throughout the body, manage the symptoms of diabetes. It also strengthens hair, maintain healthy skin, strengthens your nails, maintains a healthy LDL cholesterol, and proper function of our nervous system, and regulates blood sugar. Vitamin B7 toxicity or hypervitaminosis B7 can include red rash, usually on the face, brittle hair or hair loss, conjunctivitis, poor coordination of the body movements, also known as ataxia, lethargy, loss of appetite and nausea, hallucination, and mild depression. While the deficiency of vitamin B7 or hypovitaminosis B7, this is very rare to humans, and the symptoms include thinning of the hair, conjunctivitis, ketolactic acidosis, red rash around the body openings like the eyes, nose, mouth, and perineum. That can include hair loss or also hair thinning, weak and brittle nails, thinning and numbness in extremities, lack of coordination, depression and lethargy, and dermatitis. Vitamin B9, also known as folic acid, sources comes from spinach, dark leafy greens, asparagus, turnips, beets, mustard greens, Brussels sprouts, lima beans, sunflower seeds, liver, and seafood. There are some numerous vitamin B9 foods. We also have lentils, collard greens. Again, these are the beets, the black-eyed beans, green peas, celery, sunflower seeds, broccoli, Brussels sprouts, avocado, orange, spinach, and what else? I think that's all for vitamin B9 foods. Vitamin B9 food can help make healthy red blood cells, and this can help us avoid the problem of anemia. Folate also helps our cell to grow and multiply, form our red blood cells, form our genetic material that includes DNA and RNA, keeps the healthy function of our brain and nervous system, again, support the brain development during pregnancy and infancy, and balances the levels of homocysteine in the blood. Vitamin B9 deficiency, also known as hypovitaminosis B9, symptoms can include tiredness, weakness, heart palpitations, shortness of breath, headaches, irritability, and difficulty in concentration. That also includes the symptom of anemia. Again, that also includes the unexplained fatigue, muscle weakness, and anemia. Vitamin B9 toxicity or hypervitaminosis B9 includes the symptoms of stomach upset, nausea, diarrhea, irritability, confusion, behavior changes, skin reactions, and seizure. And now the last of all those water-soluble vitamins, which is vitamin B12, also known as cobalamin, and the sources for these are meat, fish, milk, cheese, eggs, fortified breakfast of vitamin B12, and cereals. That also includes clams, mutton, and chicken, and shiitake mushroom. Cobalamin helps make our DNA, keep the body's blood and nerve cells healthy. That includes the healthy function of our brains and nervous system, again, the formation of our red blood cell, the formation of our genetic material, the DNA and RNA, and again also helps balance the levels of homocysteine in the blood. Cobalamin or vitamin B12 also prevents megaloblastic anemia, which makes people tired and weak. Vitamin B12 toxicity, also known as hypervitaminosis B12, the symptoms include mild diarrhea, itching, skin rash, headache, dizziness, nausea, vomiting, pulmonary edema, and congestive heart failure. Vitamin B12 deficiency, also known as hypovitaminosis B12, symptoms can include tiredness or fatigue, weakness, constipation, loss of appetite, weight loss, numbness and tingling in the hands and feet, balance problems, and confusion. Again, fatigue, headaches, weight loss, impaired balance, muscle weakness, and even mood change. Vitamin B12 deficiency can also include infertility, hypothyroidism, depression, numbness, low energy, and cognitive decline. Thank you very much.